Hi friends, welcome to my new video. Today we are going to discuss about type of stomach ulcer or type of ulcer that seen in the digestive tract. So don't skip this video, let's go.
I played it innocent, a feel of discontent. I'm finally facing it all, fearless.
So which are all the major parts of your digestive tract that will go for a ulcer? Mainly a stomach and duodenum of your small intestine. So there are two types of ulcers that mainly seen in this digestive system. The first one is stomach ulcer and the second one is duodenal ulcer. So how to get rid of or how to know whether it was a stomach ulcer or duodenal ulcer? So we are going to discuss about this one by one. First we are going to discuss about the three major symptoms of a stomach ulcer. The first common symptom is you may feel a burning pain while eating, and the second common symptom is vomiting, and the third common or the last symptom is loss of weight. This first symptom, called as a burning pain, will occur when there is a food that reaches your stomach. So in this manner there will be irritation of the wounds occur that will leads to this burning pain. Mainly if you ate some spicy foods or some kind of caffeine foods, that will also cause this symptom. The second common symptom including you may feel or you may get episodes of vomiting. This vomiting will also occur if there is any irritation of this wound and mainly your stomach ulcers. So too much of vomiting may leads to hematemesis. Hematemesis mainly called as blood in vomiting. So this blood in vomiting, when you see a blood in your vomiting, you have to go for a treatment immediately because that is the first sign of an ulcer and that will leads to a cancer. And the third common symptom including loss of weight because you doesn't eat any food for your nutrition. So if you skip too much of foods, that will also leads to loss of weight. So these are all the three major symptoms of a stomach ulcer. When it comes to the second type of a ulcer, mainly duodenal ulcer, you may feel this symptom. The first common symptom is you may feel a burning pain. Mainly you didn't feel any pain while eating, but you may feel pain when the food reaches into your duodenum of a small intestine. It takes about 2 hours to reach your small intestine. So at that time you may feel this burning pain. So this is the first common symptom. Mainly you didn't feel any pain while eating, but you may feel pain after 2 hours of eating. So this is the first common symptom. And the second common symptom is you didn't feel or you have absence of vomiting. This vomiting will mainly seen in stomach ulcer. But when it comes to duodenal ulcer, vomiting is absent. So you have to note these symptoms. And the third common symptom is when it comes to the stomach ulcer, you may experience loss of weight. But when it comes to this duodenal ulcer, you didn't or your weight may get increased because while eating you may feel a burning pain. So you may try to stop this food taking. But during this duodenal ulcer, while eating you didn't feel any pain. So you may continue this eating. So this is the third common symptom for this duodenal ulcer. And the fourth common symptom is a black colored stool will be occur. So when you feel or when you see your stool in black color, that indicates a bleeding or that indicates a symptom of internal bleeding. So these are all the four common or major symptom of this duodenal ulcer. When it comes to the treatment phase, mainly your physician will give a medications including a proton pump inhibitor and antacids. These medications will be helpful to reduce your episodes of vomiting and burning pain. So this is the first common treatment. And the second common treatment is related to your H. pylori infection. If you have any history of H. pylori infection, that will also leads to this duodenal and gastric ulcer. So in this case, mainly your physician will give medicine for this H. pylori infection up to 10 to 14 days. So you can continue these medications and mainly helpful to prevent this, mainly helpful to reduce this H. pylori infection and also this duodenal and gastric ulcer. And when it comes to the food method, mainly which are all the foods you have to take and which are all the foods you have to avoid. The food mainly you have to take is yogurt. Taking yogurt in empty stomach in morning time may be helpful to prevent this H. pylori infection and also your stomach and duodenal ulcer. And the second thing is you can take so much of fruits, but avoid citrus fruits taking in empty stomach. You can take after food the citrus fruits mainly. So this is the main food you can take if you have this kind of infections. And the next thing is which are all the foods you have to avoid. Mainly spicy foods and caffeinated, mainly a coffee and alcohol and cigarette and tobacco. And the last thing is citrus fruits. Mainly these citrus fruits you can skip in empty stomach. You can also take this citrus fruit in mainly after food. And the last thing is lifestyle changes. Lifestyle changes mainly including sleep. Sleep you have to continue up to 7 to 9 hours in order to prevent this ulcer. And the next thing is don't skip your breakfast, because skipping breakfast may also cause this infections, mainly H. pylori and also this duodenal and stomach ulcer. And the last thing is avoid stress. You can avoid stress by taking, or you can go for any exercises and mainly yoga, meditations. These exercises will also helpful to prevent the stress. So you have to maintain, or you have to go for a stress management if you have any kind of a stress. So these are all the main thing or main treatment and home remedies for this duodenal and gastric, mainly a stomach ulcer. So that's all about today. Next day I will reach you with another topic. Thank you all. Have a nice day.